I thought as we begin to look through some different segments, I'd like to ask some attitudinal questions. It's always very important to know how people are feeling, how they look at the future, et cetera. And Dr. Glant, I see you at lots of meetings. I know you're talking to pathologists in meeting rooms, in hallways, at your booth, attending many of the same events that I'm at often. Give us a feel right now for your perspective on the current attitudes of pathologists. We know that we've had some major disruptions in reimbursement, and we know that inevitably there's going to be pathologists who have staked their whole career on one model of practice that's rapidly changing. So we wouldn't expect to have complete contentment. But tell me what your experience has been, let's say, in the last year or so, making the rounds as you do.
Well, Bob, I think it's pretty clear that there's a lot of nervous people in pathology and lab in general.
Right.
Pathologists are probably ahead of the pack in terms of concerned about where the industry is going in the field of medicine and where do they fit. I think a lot of them that I've talked to feel a little bit resigned to the fact that they feel that a lot of the decisions made in medicine is sort of out of their lab. It's somebody else making the decisions anymore. And in many ways, what I tell them is that, well, you can impact that decision. You can get outside the lab and explain things about the lab's value. And I think, like Matt's always tells me, that these people in the laboratory, they often don't realize that others don't understand the lab, and that they're the really ones that have to do the education. If you really want to have impact in your healthcare system, you have to go out there and explain to people why you're of value, how you can work with them to increase their value. Again, it's like anytime you give a speech to somebody, the first thing you want to do is tell them how important they are.
Right.
You know, and that you can help them continue to be important. Things like that. So again, these are part of I think the skill set that pathologists have to take on. They have to take on that if they're going to continue to be good stewards of the laboratory, part of that is getting involved more directly with the patient and with these other healthcare providers in the system that their data affects. So I think, yeah, there's a lot of concern, there's a lot of fear. But again, the way I've always approached fear is to get educated about it, figure out where it is, and then try to become an agent of making change, put me in a better position. So again, I think that's where I see it. A lot of people feel a little bit paralyzed.
Okay.
And I think what we want to do at Orchard Software is to give them something to combat that paralysis, is to give them something that they can talk to others as they come in the lab and talk about their fear of medicine. They can become colleagues with them in that concern, and yet say, how can we form a teamwork situation here that we can both get what's good for our patients in the healthcare system, rather than just being a number on a piece of paper that gets changed by someone upstairs. And so I think that's really, you got to take hold of your own future a little bit. But I don't think anybody would be understating the fact that pathologists are a little bit stunned and kind of trying to figure out when the smoke clears. Will it clear? What will I do next? And I think we can't wait for them to have that understanding. We've got to give them tools and ideas to start finding that path to a better way.